This is Radio Health Journal. I'm Nancy Benson. This week,
when your skin is defective,
how kids' allergies and asthma often start with dry, cracked skin.
then foods that are in the environment can come through the skin.
When Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics, from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
She's willing to take the risk and put herself out there and get more likes and get more followers.
The evolution of influencer marketing. Then,
many people had never seen destruction or devastation on this scale.
It's been 150 years since the Great Chicago Fire. We'll take a look back at the fire that forever changed Chicago. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Allergy season isn't over yet, and unfortunately, allergies have no cure. A lot of people develop allergies and asthma in grade school, but researchers are finding that they can often be traced back a few years to dry skin and food allergies in infancy.
Food allergy and atopic dermatitis can occur during the first year of life. The combination causes the entire body to be very highly sensitive to the environment.
That's Dr. Donald Leung, head of the Pediatric Allergy Division at National Jewish Health in Denver, the nation's leading respiratory hospital.
As children breathe in things that they're allergic to, or they get viral infections that may affect the barrier of the lungs and the nose, then these babies go on to have what's called the atopic march, which starts with eczema or atopic dermatitis, marches on in the next step to food allergy, followed by the next step, asthma or allergic rhinitis. That can evolve over the course of 3 to 6 years.
It all starts with eczema, the result of a lack of proteins in the skin that normally would retain water. Leung says it's a disorder that affects more than 15% of infants, and about a third of them will go on to develop food allergies. It's a cycle of events piling on top of each other.
I like to tell my patients their skin is like a potato chip. If you bend a potato chip, the potato chip will crack, and then it creates fissures as well as openings in the skin, which allows infection or allergens from the environment to invade in, and then that causes the body to react to it. Foods that are in the environment can come through the skin, and the skin was not meant for eating. If other family members, as an example, are eating peanuts around the baby, then the peanut can come through the skin. And when any protein or allergens in the environment come through the skin tends to make an allergic response. And that can cause the entire body to erupt whenever the person comes in contact with that food.
A fraction of those children will then go on to other allergies and asthma.
We know based on animal models, not necessarily in humans, that when you apply the food to the skin of a mouse, that they can get asthma or food allergy. We also know that when patients have a defective skin barrier, and these are the humans, that they can also get a food allergy and more asthma. So we know the atopic march can occur because of a defective skin barrier. The skin's too dry, and you're getting cracking, and then allergen invasion. Or irritants in the environment can do this. Exposure to foods on the skin can do this. And we know infection can do this. So if your barrier is defective, then there's more tendency for infection to occur.
Leung is doing research on whether the atopic march can be stopped in its tracks at the very first stage by halting eczema in infancy.
If you think of a potato chip If it's very dry, it cracks when you bend it. But if you had a wet potato chip, even though it wouldn't taste very good, if you bend it, it's not going to crack. And so what we teach our patients is to do a therapy called soak and seal, because we want to drive moisture into the skin. Now, because their skin is missing proteins that are needed to trap moisture and the skin becomes very dry, if they don't be mindful of ensuring their skin is well moisturized, then they will develop eczema as a result of invasion from environmental factors that may be damaging the skin. What we don't know yet is if we intervene and improve the skin barrier, whether that would block the atopic march. That's research that needs to be done. But it's important research because there is no cure for asthma.
Soak and seal is what doctors prescribe to moisturize the skin. It's not difficult, but it sounds like it can be messy.
You're exposing the skin to water. And this is classically for a young child taking a bath. And then it takes water roughly 3 to 10 minutes to penetrate through the skin. As I told you, these people have very dry skin. So the water goes through the skin, and then you want to trap it. Now, you know, of course, from high school science projects that water and oil do not mix. So what you want to do is put something oily on the surface of the skin to prevent the water from evaporating from the skin. So that is what's meant by sealing the skin. And doing this soak and seal then allows patients' skin to be better moisturized, less likely that they're going to get cracked, and allow irritants or allergens to penetrate.
Leung says even how a baby is born can affect whether they'll develop allergies or not. It may help to explain why more children have allergies today than when C-section births were less common.
We now know that vaginal deliveries, for example, at birth, are much more beneficial than having C-sections, which take a baby right from a sterile environment without any exposure to the mother's bacterial flora. And the mother is protected not only with breast milk, but also through her bacteria, either going through the birth canal or just skin-to-skin association.
So it's clear that allergies are complicated and may start years before they actually show up. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Flu season is here, and flu is similar enough to COVID-19 to create dangerous confusion. SARS-CoV-2 can result in more serious illness, but initial symptoms are often similar: fever and chills, a cough, runny nose, and shortness of breath. COVID-19 seems to spread more easily than flu, and people are often contagious longer. Dr. Manoj Gandhi, Senior Medical Director at Thermo Fisher Scientific, says, unfortunately, you can't tell the difference by symptoms alone.
Simultaneous testing for SARS-CoV-2 and influenza viruses is essential. Multiplex PCR technology allows for testing of multiple viruses and co-infections at the same time, which provides proper diagnosis, reduces transmission of COVID-19, monitors the spread of both COVID-19 and flu, and saves valuable testing resources.
Multi-pathogen PCR testing helps drive swift and accurate treatment decisions to help simultaneously manage flu season and the COVID-19 pandemic. Find out more at thermofisher.com/COVID-flu information. Cataracts are the #1 cause of vision loss in America and a common part of aging. Now, there is an opportunity for people with cataracts to enhance their vision thanks to innovative technologies in cataract replacement lenses. Acrosoft IQ Vivity is a first-of-its-kind lens, delivering high-quality 20/20 distance vision, excellent intermediate, and functional near vision. People who chose Vivity reported improved vision at various distances for activities such as watching their grandchildren play, working on a computer, and reading. 90% of patients with Vivity stated they are satisfied with their results and would get it again. To learn more about Vivity, visit mycataracts.com. Acrosoft IQ Vivity Extended Vision Family of IOLs. Important product information. Description. The Acrosoft IQ Vivity Extended Vision IOL is a type of IOL used to focus images clearly onto the back of your eye or retina to allow clear vision after the cataract removal, providing clear distance vision, better intermediate, and some near vision compared to what a monofocal IOL would provide. There is a chance you may still need glasses for distance, intermediate, and/or near vision. Side effects include visual disturbances such as glare, rings around lights, starbursts, and a decrease in ability to distinguish objects from their background, especially in dim lighting. These side effects may make it more difficult to see in some situations. Contrast sensitivity, an important measure of visual function, is the ability to distinguish objects from their background, especially in dim lighting. In the Acrosoft IQ Vivity IOL clinical study, contrast sensitivity in dim lighting was reduced in patients who received the Acrosoft IQ Vivity IOL compared to those who received the monofocal IOL. Attention! As with any surgery, there are risks involved. Prior to surgery, ask your eye doctor to provide you with the patient information brochure for the proposed Acrosoft IQ Vivity Extended Vision IOL to be implanted. This document will further inform you of the risks and benefits associated with this IOL. Discuss any questions about possible risks and benefits with your eye doctor, as well as your medical condition and any eye disease you may have. For more information, visit mycataracts.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
I think we should all start working under an assumption that our privacy is gone.
Facial recognition, the final straw that means social media companies know virtually everything about you.
Then the inside story of wildlife crime prevention.
We have animals committing manslaughter, home invasion, breaking and entering, trespassing, jaywalking, vandalism. Yeah, they're just animals being animals.
All that and more on Radio Health Journal.